Howdy, my name is Petronella Ahenda, and I'm a student at Texas A&M University at the School of Public Health. I'm here to present to you a research study on the quality of prenatal care through digital interventions during COVID-19. This was a systematic review, and below are my co-authors. Now, we all know the devastating impact that the COVID-19 pandemic caused on various institutions and organizations, and the healthcare system was not spared. Particularly those who were undergoing prenatal care were definitely undergoing a major change, and digital interventions was identified as the most ideal healthcare platform during this specific time. Therefore, this review aims to synthesize qualitative evidence on the benefits and barriers of different platforms that were utilized among pregnant women. We used the PRISMA guidelines for the whole processes that were undertaken, and majority of the databases that we used included MEDLINE, Embase, CINAHL, PsychINFO. We used two independent reviewers for the screening processes in addition to a third reviewer who was conducting the conflict resolution whenever necessary. To include the studies, we majorly included those ones that were having pregnant women during the COVID-19 period only. In addition to that, all the studies that had digital interventions that were mentioning it based on terms such as telehealth, telemedicine, remote access, or even the virtual apps are the ones that were included. Additionally, the studies that were there were cross-sectional, longitudinal, retrospectives, and the surveys. Only studies that were published since January 2020 are those that were included. However, there was no country restriction or ages. So for those that were excluded, it was only those studies that had prenatal and antenatal care before COVID-19. Also, those studies that were mentioning postnatal care during the COVID period, we did not include those. Also, for those ones that were also excluded were those studies that were published before the year 2020. Additionally, all reviews, opinions, editorials, and news reports were excluded. We only wanted studies that had patient perceptions, that is, maternal women, and therefore clinician perception studies were excluded. Out of the extensive research, we were able to identify over 2,000 studies. 761 of those were duplicates and were therefore removed, leaving us with 1,317 to conduct the initial process of titles and abstract screening. 95% of these studies were excluded based on the exclusion criteria, and therefore it left us with 60 studies to conduct the full text review. From these, various studies were excluded, such as wrong study design, wrong study outcomes, or even indirect access for the telehealth medicine. And therefore, this left us with about 24 studies to conduct the systematic review. From the 24 studies, we were able to identify that out of these, 14 of them were from the US. Others were also found from countries in Europe, Asia, and Australia. From these studies, majority of them were actually considered based on a combination of audio and video interventions. Other studies were only including this individual interventions such as audio only or video only or online platforms only. However, from those that were combination, we noticed that the ones who were advocating for this, it was based on various reasons, and majority of the reasons for the combination was based on high pregnancy, complications, or first-time mothers, or even language barriers as a major reason. So out of all this analysis, we were able to identify 5 overarching themes, and these included access, time, cost, literacies, and healthcare risks. To conclude, it was evident that healthcare literacy, access, and cost are major barriers that policymakers need to take into consideration, especially when reinventing or re-establishing the healthcare systems, majorly during any pandemic or healthcare calamity that might occur in future. So these are major areas that we need to look into and that need to be addressed for policymaking. These are my references, and thank you for listening.